Welcome to our deep dive.
Mm.
Today we're going to be focusing on summarizing the latest research in diabetic retinopathy.
Right.
And this is really curated specifically for ophthalmologists and other healthcare professionals.
Yeah. And, if any of your patients are interested in learning more about eye diseases in general, Professor Sarwar, who compiled all of this research, also has a separate podcast series for the general public.
Oh, that's interesting.
You can find it by searching his playlist of eye diseases for the general public.
Very cool. Very cool. So we're going to be going in depth on all the recent advancements in diabetic retinopathy.
Yeah.
To start off, I guess let's take a look at where things stand with diabetic retinopathy today. What's the current prevalence, and are there any surprises in terms of risk factors?
Well, one study we looked at conducted a systematic review and meta-analysis of diabetic retinopathy prevalence in East Africa.
Okay.
They found a pooled prevalence of 29% for cross-sectional studies
Wow.
and 25% for retrospective cohort studies.
Those are significant numbers.
They are, yeah. And what's even more intriguing is there's a lot of heterogeneity in those findings.
Oh.
Yeah, suggesting that regional factors, perhaps specific to East Africa,
Oh, interesting.
are playing a role. And, that's really interesting because that makes us think, are there similar heterogeneities in our own patient populations that we need to consider?
I see what you mean.
Yeah.
So beyond just location, are there any other risk factors that were highlighted in the research?
Of course, elevated hemoglobin A1C,
Right.
high BMI, those are still major players.
Of course.
It really underscores what we already know. Comprehensive diabetes management is so important for reducing the risk of developing diabetic retinopathy.
Right. Absolutely. You have to think about the whole patient.
Yeah, the whole picture.
Not just their eyes.
Exactly. And in fact, another study we looked at found a link between 10-year ASCVD risk score and the development of diabetic nephropathy.
Mm-hmm.
And what's fascinating about that is that it suggests that we should be looking at a patient's broader cardiovascular risk profile to really get a sense of their susceptibility to microvascular complications.
Yeah, that makes sense. That's a really interesting connection. It's not just about managing blood sugar, but it's managing overall cardiovascular health.
Exactly.
Are there any immediate takeaways from this study for how we should be approaching patient care?
Yeah, we could consider incorporating a comprehensive cardiovascular risk assessment as part of our routine diabetic retinopathy evaluations.
Okay.
In addition to HbA1c, we could look at blood pressure, cholesterol levels, smoke and history to really get a full picture.
That's a great suggestion.
Yeah.
Now let's dive into diagnostics. How has OCT angiography, or OCTA, been changing the game when it comes to diabetic retinopathy?
Well, OCTA allows us to see the retinal microvasculature in a way that we haven't been able to before.
Okay.
Unlike traditional imaging, we can actually see tiny capillaries, assess blood flow,
Wow.
and identify areas of ischemia or leakage.
So we're getting a much clearer picture of what's happening beneath the surface.
Yeah, much clearer.
Were there any studies that specifically looked at how OCTA is being used to diagnose diabetic retinopathy?
Yeah, there was a study that used OCTA images and a few shot learning approach to classify non-proliferative and proliferative diabetic retinopathy.
I'm not super familiar with few shot learning.
Yeah.
Could you explain that a little bit more?
Yeah, so few shot learning is a type of machine learning where an algorithm can learn to classify new data even with very limited training examples.
Okay.
So in the context of this study, it means the AI model was able to distinguish between different stages of diabetic retinopathy using a relatively small set of OCTA images.
So we could diagnose diabetic retinopathy with fewer resources and less data.
Exactly.
That could be a huge advantage, especially for areas with limited access to advanced imaging equipment.
Exactly. The implications are far-reaching, particularly for underserved populations
Absolutely.
and global health initiatives.
Yeah, this technology could really democratize access to quality eye care. Now, beyond OCTA, were there any other novel biomarkers or diagnostic approaches that were identified in the research?
A couple that stood out. One study focused on peripapillary retinal nerve fiber layer blood flow density, or PRNFL, as a potential new biomarker.
Let's unpack that. What is PRNFL, blood flow density, and why is it significant?
So the PRNFL is the layer of nerve fibers surrounding the optic disc.
Okay.
Think of it as like a highway carrying visual information from the retina to the brain.
Got it.
This study found that PRNFL blood flow density was significantly lower in patients with non-proliferative diabetic retinopathy compared to healthy controls.
So that means that reduced blood flow in this area could be an early indicator of diabetic retinopathy.
Yeah, even before visible changes in the retina.
Wow.
And not just for diagnosis. It could also be useful for monitoring disease progression and treatment response.
That's really fascinating. Another potential biomarker I saw was tear glucose.
Oh, yeah.
Tell me more about that.
There's a growing body of evidence suggesting that tear glucose levels might be correlated with diabetic retinopathy.
Interesting.
So as blood sugar levels fluctuate,
Hmm.
those fluctuations are reflected in tear glucose levels as well.
So theoretically, we could use a simple tear test to screen for diabetic retinopathy
Potentially. Yeah.
or monitor blood sugar control.
Yeah, exactly. The research is still in its early stages, though.
Okay.
We need more studies to validate these findings and determine what the optimal cutoff values are for tear glucose in relation to different stages of diabetic retinopathy.
It's definitely an area to watch. Now, we can't talk about advancements in diabetic retinopathy without discussing the role of artificial intelligence.
Right.
What were some of the key AI innovations highlighted in the research?
Well, one study introduced a novel deep learning model called RSGNet.
Okay.
It achieved remarkably high accuracy in both four-stage and binary classification of diabetic retinopathy.
Other AI models. What sets RSGNet apart from other models?
Well, first of all, it's designed to handle class imbalance, which is a common problem in medical data sets,
Okay.
where you may have many more examples of one class, like, say, healthy retinas, than another, like those with proliferative retinopathy.
Right.
So RSGNet uses data augmentation techniques to create a more balanced data set, and that leads to more accurate classifications.
That makes sense. So it's kind of leveling the playing field for the AI,
Exactly.
making sure that it can learn effectively from all types of data.
Right. And it also uses something called histogram equalization and Gaussian blur to enhance the quality of the retinal images.
Oh, okay.
It makes it easier for the model to extract those crucial diagnostic features.
So it's kind of pre-processing the images to give the AI a clearer view,
Exactly.
which in turn should lead to more accurate diagnoses.
Yes.
Were there any studies that looked at how these AI models are performing in real-world clinical settings?
Yeah. There was one that used federated learning, or FedDL, to detect and classify diabetic retinopathy.
Okay. Remind me, what's the advantage of using federated learning for something like this?
So federated learning allows multiple institutions to collaborate on training an AI model without actually having to share their patient data.
Oh, wow.
So each institution trains a local model with their own data, and then only the model's learned parameters, not the data itself, are sent to a central server.
Gotcha.
And then the server combines these learnings to create a global model, which is then shared back with the institutions.
So each institution gets to contribute to developing a powerful AI model while still protecting their patients' sensitive information.
Exactly.
That's a really elegant solution to the data privacy issues.
Absolutely.
Are there any other AI advancements that caught your eye?
One study explored the potential of ChatGPT-4 to develop a risk calculator for both diabetic retinopathy and diabetic macular edema, and get this, without any coding.
That's incredible. I know ChatGPT is making waves in a lot of fields, but I never really considered its potential for healthcare. How does it actually work?
The researchers simply provided ChatGPT-4 with prompts and instructions in natural language.
Wow.
And the model was able to generate a working risk calculator.
So they were having a conversation with the AI and guiding it to create a diagnostic tool.
Essentially, yes.
That's amazing.
Yeah.
What does that mean for the future of AI in medicine?
Well, it suggests that we might be able to develop these sophisticated diagnostic and prognostic tools without needing extensive coding expertise.
Wow.
Imagine a future where healthcare professionals can just customize these AI tools for their specific needs using simple language prompts.
That would be incredible. That would make AI so much more accessible and user-friendly.
Exactly.
Now let's step away from the high-tech world for a moment and talk about the impact of lifestyle on diabetic retinopathy. What did the research reveal about modifiable risk factors?
One study investigated the relationship between physical activity and diabetic retinopathy. And they found that both a weekend warrior pattern, which is concentrated bursts of activity on the weekend, and a regularly active pattern offered protection against developing the disease.
Oh, that's interesting. So even if patients can't manage daily exercise, just encouraging them to be active a couple of times a week can still make a difference.
Yeah, every little bit helps.
That's really encouraging to hear, especially for patients who might feel overwhelmed by having to exercise every day.
Right.
Were there any other lifestyle factors that stood out in the research?
Sleep actually emerged as a potentially significant factor.
Really?
Yeah. One study found a potential causal link between daytime sleepiness and an increased risk of developing diabetic retinopathy.
Wow, that's a connection I've never really made before. How could daytime sleepiness be linked to eye health?
It's not fully understood yet, but daytime sleepiness could be a marker of underlying sleep disorders like sleep apnea.
Right.
And we know that those disorders can disrupt hormone levels,
Yeah.
increase inflammation, and affect blood sugar control.
And all those things can contribute to the vascular damage seen in diabetic retinopathy.
Exactly.
So it's not just about feeling sleepy, but what that sleepiness might be indicating in terms of overall health.
The bigger picture.
Yeah, we need to be asking those questions and digging a little deeper.
We do.
Now, before we move on to treatment approaches, did the research look at all into the role of genetics in diabetic retinopathy development?
Yeah, it did. There was quite a bit of research focusing on specific genes and genetic variations that might influence a person's susceptibility to developing diabetic retinopathy. One study looked at long non-coding RNAs, or LNC RNAs.
Okay.
And these are RNA molecules that don't code for proteins, but they can still influence gene expression.
Interesting.
They found that certain LNC-RNA variations were more common in individuals with diabetic retinopathy, which suggests a potential genetic link.
It's like these LNC-RNAs are kind of like puppet masters behind the scenes, controlling how genes are expressed.
Yeah, subtly pulling the strings.
Yeah, that's fascinating. Were there any other specific genes that were highlighted in the research?
Yeah. Another study found an association between the H19RS3NS3SF412 genotype and the development of diabetic retinopathy.
Wow.
This particular genetic variation seems to be linked to changes in glomerular filtration rate, which we know can contribute to the vascular complications seen in diabetic retinopathy.
It seems like the more we learn about genetics, the more we understand how all these different systems in the body are connected.
Absolutely.
What are the implications of these genetic findings for how we approach diabetic retinopathy?
Well, this is where the field of personalized medicine gets really exciting.
Yeah.
In the future, we could potentially use genetic testing to identify individuals who are at higher risk of developing diabetic retinopathy.
Okay.
Or who might respond better to certain treatments based on their genetic makeup.
It's like unlocking a secret code hidden within our genes.
It is.
That paves the way for truly individualized care. But for now, let's talk about the current treatment landscape. What's the latest on managing diabetic retinopathy, especially the more advanced forms?
Intravitreal bevacizumab is still a mainstay of treatment, especially for diabetic macular edema and proliferative diabetic retinopathy.
It's an anti-VEGF drug.
Exactly.
So it helps to inhibit the growth of those leaky blood vessels
Yes.
that can cause vision loss. Were there any studies that looked at the efficacy or cost-effectiveness of bevacizumab compared to other treatment options?
There was a study that conducted a cost-effectiveness analysis of various anti-VEGF drugs and panretinal photocoagulation, or PRP, for proliferative diabetic retinopathy.
Okay.
And surprisingly, they found that PRP alone may actually be the most cost-effective option.
That's a little unexpected. I thought that anti-VEGFs were generally considered the gold standard for more severe cases. Why would PRP be more cost-effective?
Well, while anti-VEGFs may have certain advantages in terms of visual outcomes, they are significantly more expensive than PRP,
Right.
both in terms of the drug itself and the need for repeated injections.
So it's a trade-off between potential differences in visual acuity versus the economic burden of treatment.
Exactly.
That must lead to some difficult conversations with patients.
It does. And it's important to remember that cost effectiveness doesn't automatically make PRP the better option. You know, each patient's situation is unique. We need to consider their individual needs, the severity of their disease, their access to care, and their personal preferences.
It's about finding that balance between effectiveness and practicality.
Right.
Were there any other studies that looked at emerging treatment approaches for diabetic retinopathy?
One study explored the use of Bayesian deep learning for diabetic retinopathy classification.
Okay, now you've got me curious. What is Bayesian deep learning and how is it being applied to diabetic retinopathy?
So think of Bayesian deep learning as a way to build more thoughtful AI models.
Okay.
Traditional deep learning models tend to give you a very confident answer,
Right.
even when the data might be ambiguous or limited. But in medicine, we often deal with uncertainty.
Of course. There's rarely a clear-cut black and white answer.
Exactly. And that's where Bayesian deep learning comes in. It allows the model to express a level of uncertainty in its prediction.
So it's like the AI is saying, I'm pretty sure this is the answer, but I could be wrong, and here's how confident I am.
Exactly. And that level of transparency can be really valuable in a clinical setting
Right.
because it allows us to interpret the AI's recommendations with a more nuanced understanding of the potential for error.
It's like having a more realistic conversation with the AI.
Exactly.
Rather than just getting a yes or no answer. Did this study show promising results?
It did. They applied Bayesian deep learning to a convolutional neural network, or CNN, model for diabetic retinopathy classification.
Okay.
And they achieved high accuracy while also providing these valuable insights into the model's uncertainty.
That's really encouraging. So not only are these AI models becoming more accurate,
Yeah.
but they're also becoming more transparent and reliable,
Right.
which is really essential for clinical decision-making.
Yeah.
Now, before we wrap up this part of our deep dive, there's one more study I want to touch upon. It focused on the role of vitamin B6 in diabetic retinopathy.
Okay.
Tell me more about that.
This study investigated the relationship between vitamin B6 turnover rate and the risk of developing diabetic retinopathy. And they found an association between a higher vitamin B6 turnover rate and an increased risk of the disease.
Vitamin B6, that's not something I would have immediately associated with eye health. Why would vitamin B6 be involved in a condition that primarily affects the eyes?
That's a great question, and that's what researchers are trying to figure out. The study suggests that endothelial activation and stress,
Okay.
meaning dysfunction in the cells lining our blood vessels, might be the mediating factors.
So it's not that vitamin B6 is directly impacting the eye,
Right.
but it's playing a role in overall vascular health,
Exactly.
which we know is crucial for preventing diabetic retinopathy.
Yes. It all comes back to the whole body.
Yeah.
The body is a complex web of interconnected systems. And seemingly unrelated factors can play a surprising role in disease development.
Well said. So we've covered a lot of ground in this first part of our deep dive.
We have.
From prevalence and risk factors to cutting-edge diagnostic techniques and even some of the latest treatment approaches. It's clear that the field of diabetic retinopathy is rapidly evolving.
It is.
What stands out to you as the most significant takeaway from all this research?
For me, it's the convergence of technology and personalized medicine.
Yeah.
We're really on the cusp of a new era where we can use AI genetic insights and these novel biomarkers to tailor diabetic retinopathy care to each individual patient.
It's an incredibly exciting time to be in this field.
It is.
Welcome back to our deep dive into the latest advancements in diabetic retinopathy. We covered a lot in the last part about the current landscape of the disease, the prevalence, the risk factors, some new exciting diagnostic tools.
Yeah.
But now let's shift our focus to treatment approaches and some considerations,
Okay.
especially with all this new debate about cost-effectiveness of different options.
Yeah, that's right.
That analysis that showed that panretinal photocoagulation, or PRP, might be more economical for proliferative diabetic retinopathy was really interesting.
Yeah, it really challenges what we've been thinking.
It does. For our listeners who might need a refresher, could you walk us through how PRP works and why it might be more cost-effective than other treatment options?
Sure. PRP uses a laser to treat specific areas of the retina, targeting those abnormal, leaky blood vessels that cause problems in proliferative diabetic retinopathy. It's like creating controlled burns in the peripheral retina to prevent further damage and vision loss.
So you're basically tackling those abnormal vessels early on.
Exactly.
So you don't have to do more costly interventions later.
Right. And while anti-VEGF injections have their benefits for visual acuity, they do come with a hefty price tag, and they require those repeated injections.
Right.
PRP, on the other hand, is a one-time procedure with a much lower cost.
So it's really a balancing act.
It is.
You have to weigh the potential visual outcomes against the economic realities of treatment. I'm sure that leads to some interesting conversations with patients.
It does. And it's important to remember that, cost effectiveness doesn't always equal the best option.
Right.
Each patient is different. We have to consider their individual needs, the severity of their disease, their access to care, and their personal preferences as well.
Absolutely. It's about having all the information and then tailoring your approach to the patient in front of you.
Exactly.
Now, we also talked about lifestyle choices in the last part.
Yeah.
That connection between daytime sleepiness and an increased risk of diabetic retinopathy was really interesting.
Yeah.
What are your thoughts on that?
I think it just highlights how interconnected all of our patients' health is. Daytime sleepiness could be a sign of something else, like sleep apnea, which we know can have a ripple effect on the whole body.
So we need to be thinking about more than just the eyes.
Right.
The bigger picture.
The whole patient. Exactly. Sleep disorders disrupt hormones, increase inflammation, can even affect blood sugar control, and those all contribute to vascular damage.
Right.
which we know is what we see in diabetic retinopathy.
So we should be asking our patients about their sleep habits.
Oh, definitely. It all ties back into that holistic approach.
Absolutely.
Lifestyle factors, comorbidity, sleep, it all plays a role.
It all matters.
Yeah.
Speaking of interconnectedness, we touched on genetics briefly.
Yeah.
And its influence on diabetic retinopathy.
Right.
I was wondering if any of these studies looked at how these genetic insights might lead to more personalized treatment approaches.
Not specifically in this set of research, but the field of pharmacogenomics is exploding right now.
Okay.
And the goal there is to use genetic information to predict how an individual is going to respond to certain medications.
So in the future, we might actually be able to tailor diabetic retinopathy treatments to a specific patient's genetic profile.
Exactly. Imagine being able to choose the most effective treatment with the fewest side effects just based on someone's genes. That's the promise of personalized medicine.
That is incredible.
Yeah.
And, the genetic studies that we discussed earlier are really paving the way for that future.
They are.
Now, I want to shift gears back to AI.
Okay.
Because there are so many amazing advancements happening right now.
Absolutely.
Are there any applications that are being developed specifically to help us make treatment decisions for our patients with diabetic retinopathy?
Well, while it wasn't specifically addressed in these studies, AI is showing so much promise in this area. Imagine an AI system that analyzes a patient's retinal images,
Oh, yeah.
their medical history, their genetic information,
Wow.
even their tear glucose levels to recommend the absolute best treatment strategy for them.
That's incredible.
Yeah, it would be like having a virtual consultant right there by your side,
Right.
helping you weigh the pros and cons of each option.
Exactly. And as these systems learn from more data,
Yeah,
they're just going to keep getting better.
absolutely.
It's like looking into a crystal ball, but one that's based on evidence and data. That's a great way to put it.
Speaking of AI, you mentioned a study that used Bayesian deep learning for diabetic retinopathy classification.
Right.
Could you remind me what's so unique about this approach?
Yeah, so Bayesian deep learning is all about embracing uncertainty.
Okay.
Traditional AI models are very confident in their answers,
Yeah.
even when the data might be limited or ambiguous.
And as we've discussed, medicine is rarely black and white.
Exactly.
Yeah.
So Bayesian deep learning allows the model to express some level of uncertainty in its prediction,
Okay.
which is much more realistic and helpful in our field.
So instead of just saying yes or no, it's saying, I'm pretty sure this is the answer,
Right.
but here's how certain I am.
Yeah, and that transparency can be really valuable
Right.
because it allows us to interpret the AI's recommendations with more nuance.
That's a good point.
We can understand the potential for error.
It's like having a more collaborative conversation with the AI.
It is.
Rather than just getting a directive.
Exactly.
Did this study show promising results? It did. They applied Bayesian deep learning to a CNN model for diabetic retinopathy classification, and they had high accuracy while also providing those insights into the model's uncertainty.
That's great. So these models are not only becoming more accurate,
Yeah.
they're also becoming more transparent
Right.
and more reliable,
Right.
which is really essential if we're going to integrate them into how we practice medicine.
Absolutely.
Now, before we move on, I wanted to circle back to something you mentioned earlier about corneal nerve abnormalities in early-stage diabetes.
Oh, yeah.
Could you tell me more about that research?
Yeah, it's a fascinating area. Remember, diabetes affects the whole body,
Right.
including the nerves. The cornea, the clear outer layer of the eye, is richly innervated.
So damage to those corneal nerves could potentially be a sign of diabetic neuropathy,
Exactly.
which we know is a risk factor for retinopathy.
Exactly. And this study found that certain corneal nerve abnormalities, things like reduced nerve fiber length and density, were present even in patients with very early diabetes who hadn't even developed diabetic retinopathy yet.
So that could be another early warning sign
It could.
help us identify high-risk individuals.
Exactly. And it just goes to show how AI and these advanced imaging techniques
Right.
are allowing us to see these tiny signs of diabetic damage, even in those really early stages.
That's like having a magnifying glass for the body.
Right.
You can see all these hidden connections and patterns.
Exactly.
This has been a really illuminating discussion on the latest treatment approaches for diabetic retinopathy.
It has.
I'm curious what you see as the most exciting development in the field.
For me, it's just the incredible speed of innovation. We're seeing breakthroughs in AI personalized medicine and even our understanding of how diabetes affects the nervous system.
It's a really exciting time to be involved in this field.
It is.
But I imagine with all this new technology and information, it can feel a bit overwhelming.
Oh, for sure.
What advice would you give to clinicians who are trying to keep up with everything that's happening?
I think the most important thing is to just embrace lifelong learning.
Okay.
Stay curious, attend conferences, read the latest research, and, talk to your colleagues.
Don't be afraid to ask questions,
Never.
even if they seem basic.
Especially if they seem basic. We're all learning together.
Yeah, we're all on this journey together.
We are. And by sharing our knowledge and experiences, we can continue to improve care for our patients with diabetic retinopathy.
Welcome back to our final part of this deep dive into diabetic retinopathy.
Yeah.
We've covered so much ground in the last two parts, talking about the prevalence, the risk factors, new diagnostics, treatment approaches.
Yeah, it's been quite a journey.
It has been. But now I want to sort of look ahead. What does the future hold for managing this condition? What are you most excited about?
For me, it's the combination of AI and personalized medicine. I think we are moving towards this future where we can use these powerful AI tools to analyze everything, a patient's retinal images, their genetics, lifestyle factors, even tear glucose, and really tailor treatment just for them.
It's like having a personalized roadmap
Exactly.
for each patient's journey with this condition.
It really is, and it's exciting.
It is exciting. And something else that really stood out to me was the focus on early detection and intervention.
Absolutely.
We talked about OCTA being able to visualize those tiny vascular changes,
Right.
the potential of corneal nerve assessments and tear glucose testing.
Yeah, those are game changers.
Feels like we're becoming so much more proactive.
We are, and it's not just about these fancy technologies.
Right.
This research really hammered home the impact of lifestyle choices as well.
Absolutely.
We need to educate our patients and empower them to make healthy choices.
It's a good reminder that even with all these incredible advancements, we can't forget those basic things.
Right.
Healthy diet, exercise,
Street.
stress management.
All of that.
Our patients need to be active participants in their health.
Absolutely.
Yeah.
Not just passive recipients of treatment.
Exactly. But I'm curious, how do we take all of this research, all this information, and actually apply it in the real world?
That's the million-dollar question.
Yeah.
I think one challenge is just the sheer volume of information
Right.
and the speed at which things are changing.
It's hard to keep up.
It is. New tools, treatments, and AI systems are popping up all the time.
I can imagine.
It can be tough to stay on top of it all.
So what's the answer?
Well, I think lifelong learning is more important now than ever before.
Okay.
We need to stay curious, go to conferences, read the latest research.
No colleagues.
Talk to colleagues, exactly.
Don't be afraid to ask questions, even if they seem basic.
Yeah, especially the basic ones. We're all learning and growing together.
We are. And it's not just about individual clinicians staying up to date.
Right.
We need to be better about collaborating and sharing knowledge across the entire healthcare system.
Absolutely. We need better communication between researchers, clinicians, and policymakers.
Right.
To make sure that all these incredible breakthroughs actually translate into real benefits for patients.
I completely agree. We need to break down those silos and work together. Initiatives like federated learning can play a big role here.
For sure. Federated learning lets institutions pool data and expertise without sacrificing patient privacy.
Right.
So we can develop new approaches much faster.
But even with better collaboration, we can't ignore the issue of access.
That's a huge one.
A lot of these new technologies, especially AI systems, can be expensive.
They can. And we need to make sure that everyone benefits from these advances.
Exactly. We don't want to create a system where only certain patients can afford the best care.
Absolutely. We need to advocate for policies and funding models that prioritize equitable access for everyone.
I couldn't agree more. Now, on a broader level, how do we address the fact that diabetic retinopathy is becoming more and more common?
Right.
Diabetes rates rising globally.
It's a tough one, but I think prevention has to be our top priority. We need public health initiatives that encourage healthy lifestyles.
Right.
We need to catch diabetes early and provide comprehensive management to those who have it.
It's about tackling the problem at its source.
Exactly. It's a team effort.
Right.
Healthcare professionals, policymakers, community organizations, and individuals all need to work together.
I think that's a perfect note to end on.
It is.
This has been such a fantastic discussion.
He really has.
So much valuable information.
A lot to think about.
A lot to think about. To all our listeners, thank you so much for joining us on this deep dive.
Thanks, everyone.
We hope you found it valuable and thought-provoking. And remember, knowledge is power.
Absolutely.
Especially when it comes to protecting vision and helping our patients live their best lives.